on the NewsChannel 5 network. This is Open Line.
Hello, everyone. Welcome to Open Line. I'm glad you're with us tonight. It is Tuesday, April 7th, but we are recording this show, so don't call in. We're recording it a little earlier in the day because our guest is in a different time zone. Our guest is actually in Switzerland, where it is 10 o'clock at night. So we wanted to record it in the daytime and then bring you this interview. Tonight we are talking with a Dr. Margaret Harris from the World Health Organization. The World Health Organization, again, located in Switzerland. We want to get just the most factual, straightforward information possible on the coronavirus. And we're very happy that Dr. Harris has agreed to be with us via Zoom. So Dr. Harris, thank you for being with us.
It's a pleasure.
All right. A lot of questions that we can cover over the course of this hour. A lot of rumors out there, that kind of thing. I want to get into all of that. But first of all, where are we right now with this pandemic? Are we plateauing? Are we not? Where are we worldwide right now with this pandemic?
So worldwide, we are still in an intense acceleration phase. That's currently driven by the very large outbreak that you're suffering in the United States of America. Some other parts of the world have managed to slow down their outbreak. In East Asia, we've seen some success. That South Korea has brought their case numbers right down. Also in China, we've seen a big reduction in case numbers. They're still reporting new cases. Nobody has been able to shut down this outbreak completely. But the good news is in a number of countries they've been able to bring it down, so we can see that it is a reversible outbreak. This virus can be beaten. We're seeing the same thing in Europe, even though, again, we've seen huge outbreaks in Europe. Massive outbreaks that have overwhelmed health systems. But eventually, through very, very, very big commitment by societies to going through very difficult times and putting up with great restrictions, that in many of the countries that we're seeing very, very severe outbreaks, eventually the numbers of new cases are beginning to fall. And that's a good sign that they too are beginning to reverse their outbreaks. So
I want to ask. Oh, okay. I want to ask more about Europe and where things stand there, because I think it kind of indicates where we may be headed. But before I ask that, I want to ask about some of these third world countries. I mean, when I look at India and I look at some of these densely, highly populated countries, I just wonder what in the world is going to happen there. And so what is happening there, and what do you predict will happen in some of these very highly densely populated countries?
In any community, any country where you've got people living very closely together, and this is common regardless of your wealth. I mean, Hong Kong, which is one of the wealthiest countries, has the most densely populated square mile in the world, certainly from the last time I looked at figures. So it's not about your financial status, it's about how humans choose to live together, or how culturally they have just become like that. So in any city where people are living very closely together, a respiratory virus, which relies on jumping from person to person through the droplets that we breathe out, that we cough out, that we sneeze out, that sort of pathogen loves it when we crowd together. That's why it loves the winter, because wintertime tends to be the times when humans really herd together. That's when we're physically close. So that's why we make a big deal about this physical distancing idea.
What are you seeing in Europe right now? It seems like there's some good news out of Italy, but what are you seeing as far as the virus throughout Europe right now?
So throughout Europe right now, very, very large outbreaks. Different countries have managed to deal with it different ways. The countries that have really focused on testing, where they have tested everybody who is either sick with the virus or potentially sick with the virus, has enabled them to keep eyes on where that virus is. And what I mean by that is, you test people to find out whether they've got it. Then you also speak to all the people around them, and you spend a lot of time doing very good detective work. And this is the kind of thing that your Centre for Disease Control is brilliant at. They've trained the world in how to do this. They are really good at that. And this is hard work. This is detective work, the kind of thing that an investigative journalist does when dealing with a story. But this is the medical detective work, to find out exactly who has been exposed to that virus. You find all those people and you make sure that they self-isolate. You explain to them how to do it. You make it possible for them to do it. If you're in, like we were talking before, a society that's very crowded, you have to find a place where they can self-isolate. I've just spent the last 9 months working down in the Democratic Republic of Congo with Ebola. We could only finish that outbreak by finding places where people could be isolated. So these are old-fashioned things. They work, but you have to find ways to make them work. Now, in the countries where they've done those things, they have been able to slow down their outbreak. And by slowing down their outbreak, they've given time for their health systems to get ready and for their health workers to be prepared, to have the personal protective equipment, the space in the hospitals, the backup teams, to be able to deal with the people who've come through and then look after those people. So this is one of the really important things to understand with this virus. A lot of people are going to get it. 10% of people will get super ill. Now, if your numbers are low, say you get 1,000 cases, that's 100 people. But if you get 100,000 cases, that's thousands of people you're trying to look after, 10,000s of people. And there's no hospital in the world that can deal with that number at the same time.
And so you mentioned China is seeing a decrease, dramatic decrease. But are we seeing this kind of resurface? I think there's a concern that in these areas where they have beaten it or tamped it down dramatically, that there could be a second surge. And we've seen that with other pandemics, right? The Spanish flu of 1918. What are you seeing? Is there a resurgence in some of these countries that have been through this already?
There are a couple of important issues to understand there. First of all, this is not influenza. It's an entirely different virus. It causes some of the same symptoms, so people have understandably been a bit confused and thought it's like influenza. It's not. It's a new disease. It's a new virus. It's behaving quite differently from other viruses in the past. So looking at the Spanish flu doesn't give us that much information. But it is important to understand when you've finished it in your society, because we are, again, very different from how we were 100 years ago. We are super connected. We can be in, as I'm sure you know, you can be on the other side of the world within 24 hours. So if you're carrying a virus in your body, you can take it somewhere else very, very quickly before anybody knows, including yourself, that you've actually got the virus in your body. So China at the moment is struggling with that very thing. Many of their nationals who've been, say, students who've been studying in the United Kingdom or in Europe want to come back home. You know, everything's shut down. So now they're trying to come back home. And the danger is that they are then bringing the virus back to China with them.
So we're here in a state of complete, really, lockdown. I mean, it's a pretty dramatic thing, something I've never seen in my entire life. And the question everyone is asking is, how long will this last? And with the World Health Organization and the benefit you have of looking at other communities that have successfully dealt with this or are still dealing with this, what do you say? How long are we going to need to be in the shutdown that we feel like we're in right now?
Well, if we looked at, say, Wuhan in China, which had this massive outbreak that started slowly, didn't really start to get going and peak until mid-February, but they were really looking at a month of intense infection. Now, you could say, okay, that looks like a month or two, so don't think of anything less than a month or two. But also remember, it does go society by society, community by community. Now, if you've taken quite significant measures and your community is really, really engaged, really committed, and is really doing the things they need to do seriously, the hand hygiene, the ensuring that the environment is absolutely pristine, ensuring that they catch every cough with a tissue or by covering their mouth and nose, ensuring that they genuinely socially distance, that they do stay away from each other. Those things may slow it down more quickly. Some other societies have been able to do that more quickly. So as I said, don't expect things to be over for a couple of months, but do expect that the more effort you make to do these things, the quicker the relief will be.
And now what you said is going to scare a lot of people. You said don't expect things to be over for a couple of months. Are you recommending that we stay on this level of lockdown for a couple of months, or do we slowly loosen what we're doing, or what are you saying there?
No, we don't really have a blanket recommendation. So our overall recommendations are really focusing on the testing, ensuring that you get all the tests done, ensuring that you identify all the people that are infected, ensuring that those people self-isolate. The lockdowns, the societal changes, these are decisions that your local authorities make, ideally in conjunction with communities, understanding how their communities work and what you can do best with communities. So we certainly don't have any blanket recommendation that says you have to be in those circumstances. However, if you've made those decisions, then you need to think about how, as things improve, how do you relieve, how do you get out of the lockdown, how do you slowly come back to normal, and what does that normal really look like? Are you going to return to the conditions under which you had the large outbreak, or are you going to change into a society that looks very hard at what things you need to change to ensure that this kind of transmission will no longer occur in your community?
So you're saying this may not be a short-term thing, this could be a transformational thing, that we need to look at changing potentially forever how we interact. Is that right?
Entirely, yes. So one of the things that viruses love about what we humans do is the way, as you were describing before, we crowd together. We're increasingly more and more urbanized. We're spending much more time in very, very small spaces. We spend a lot of our time in transport where we're close together. The way we often work in this kind of boiler rooms where we're cheek by jowl. We all think that we need to go to offices or some place of work. Perhaps we should be looking at the teleworking we've had to do during this period as something that might be the better way to work. And that even though, yes, we are very social, humans are very tribal, we're tribal animals, we do like to be physically together, but perhaps we need to be physically together less because we're giving the viruses a wonderful opportunity to take advantage of us.
Do you have a sense that if you have gotten the virus and recovered, that you are then immune and you won't get it again? Do you have a sense of that? Do we know?
Unfortunately, we don't have that information yet. As I mentioned before, the coronavirus family are very, very different from the influenza family and from a lot of the other virus families. So you cannot just say because these viruses do that, this virus will do that. So one of the things when you're looking at immunity, you measure antibodies, but the other thing you have to do with antibodies is look at, as somebody has those antibodies, does that prevent them from being reinfected when they get re-exposed? And these give you an idea of what you call correlates of immunity. It gives you an idea of if your immunity level is at this level and you're exposed to that virus and you don't get sick again, well and good. Unfortunately, some of the other members of this family seem to be coming back every few years. People's immunity seems to drop and they seem to get the same old virus year after year. These are coronaviruses that give us colds. And as you know, everybody gets colds every year. And some of the studies have found that it's the same old virus coming back every 2 years, giving you that cold. Now, having said that, we don't know enough about this virus to say that's true. All I'm saying is there's enough information about this family to suggest we cannot guarantee that having antibodies against it will give you the level of immunity we'd all like to have.
And the other big question is, what about some sort of vaccine, some sort of treatment? How feverishly are people working on that? How optimistic are you at the World Health Organization that some sort of vaccine, some sort of treatment can be found?
This is one of the things that has just honestly brings tears to my eyes. The level of passion, the commitment of the entire scientific community to crack this one. I've been working in vaccines for a very long time. I've been working with some very nasty viruses, including the Ebola virus and the yellow fever virus. And if you look at the history of the vaccines developed for many of the viruses that have been an enormous threat to human health, it's taken a very long time. Even the Ebola vaccine, which we developed in record time, still took many years. Yet we have something like 50 different vaccine candidates being looked at. Tests have already started. Tests of a potential vaccine started within 60 days of us knowing, we the humans, knowing that we had this virus in our population. That has never happened, and this has been possible because the genome of the virus was identified within a couple of weeks of the thing arriving. It arrived a month earlier, but within a couple of weeks of us identifying that there was a virus that was causing this problem, the genome was identified. It was shared with the entire scientific community, and from that, first of all, we had the test, and now we have all these different groups working feverishly to find a vaccine. On treatment.
How long do you think that might take? It could take years? Is it possible it could happen next month?
Well, usually it takes years, but the way these teams are going, the rate-limiting step, the slow step is an important one, and that is human safety testing. So, sure, you work out pretty quickly, you've got a vaccine that's stimulating the kind of antibodies you hope will give you this protection. And remember, I was talking to you, mentioning before, we're not 100% sure what level of antibodies will give you the kind of protection you want. So you stimulate the antibodies, great. What do you do then? You need to know that it's a safe vaccine. Before you go any further, you need to know that anybody you give it to is not going to have side effects. And there are side effects that you have immediately with the vaccine, and there are side effects you get later. So you need to give it to somebody over quite a period of time and observe them. At the same time, you'll be measuring what kind of antibodies it's stimulated. And you want to see, did it stimulate this level and did it stay at that level, or did it drop to a point where it probably won't protect? After you've done that, after you've got a good idea of the antibody profile, you've got a good idea that the thing is safe, that you can safely give it to the general public. The next thing you need to do is find a way to see in this person that it stimulated the antibodies in, if they're exposed to the virus, does it stop them getting the illness itself? So that's the third level of testing that you need to do. Now you can probably do that at the same time as the safety testing, because we've got so much virus out in the community. There are various ways you can test whether it's working, but still all that kind of scientific observation that you must do to ensure this will be a vaccine that's safe to give to people. Because remember, you give a vaccine to a healthy person. You don't give it to a sick person. So you're giving it to somebody who's starting out healthy in order to protect them. So, and you really wouldn't be able to have the right level of information to guarantee the safety unless you've really been testing it for at least 12 months.
So it's going to take some time. Okay, fascinating conversation. We're talking with Dr. Margaret Harris with the World Health Organization in Switzerland. We're recording this. It's Tuesday, April 7th. We're recording this because it's 10 o'clock at night where Dr. Harris is. Currently, it's mid-afternoon here. So we are not taking phone calls. We're going to take a break. I'm going to come back. She's mentioned a couple things about Ebola. I'm going to ask her to compare this to some other viruses or outbreaks we've heard of. We'll take a break. Be back right after this.